going to talk about the head ring for just a few minutes here. Both the head ring and the chin ring. Typically, you'll get the question, well, can I put something on to protect the skin? The answer is no. Do not let them put anything in there, particularly gauze of anything that's got any kind of abrasive texture to it. If you put abrasive textures, I will guarantee you, you will have ulcers here, here, and across the top of the forehead. If in the event you get reddening, you can give a little bit of relief in the pressure, but do not do it to the point where they can move their head. And the way you give a little bit of adjustment there, all you need to do, open that up, loosen it up about 1/4 of an inch. Do not go any further than that, just a little bit. You do that on both sides. And that will give the patient a little bit of relief. That silicone is much softer than the durometer of skin. For the most part, you won't have problems. However, if you end up with an ulcer, new skin, polymem, there's a couple of new products out on the market. I'm not even sure the current names for them, but there are some very good products, and all you want is something that forms a barrier that's basically something to prevent friction. And friction is more the culprit in creating any form of a sore. In the chest area, if you ever have the situation of having to put a chest tube in, you can either cut the area out, which I don't recommend, but I've had a situation where I've had to, or you can get some 1-inch thick plastizote, form a horseshoe-looking piece, and it will literally go underneath, around the G-tube or J-tube to hold the brace away from it. If you are lucky enough to work with the surgeon who's putting the G-tube or J-tube in, ask them to put a 90-degree input. Colostomy bags will also create kind of a challenge. What I have ended up doing on the colostomy bag is, once again, the 1-inch plastizote. Make sure that all the edges are rounded, and that'll hold the brace away from the colostomy bag enough that it will drain. Removing the colostomy bag sometimes gets to be a little bit of a challenge. What you can do is with 2 people. Come back over on this side. If you have that situation, one hand goes behind the back, one hand goes here. Let her lean back just a little bit. You can release number 5. That'll let this move a little bit. You'll be able to get the colostomy bag out. Stay or do in the supine position. Once again, number 5, when you go to put it back in, make sure your fingers are protecting the skin.